Separately, I want to provide an update on our vaccination campaign. To date, 133,844 doses have been administered in Rhode Island. That's 93,489 first doses and 40,355 second doses. To this point, we have been very targeted in who we are vaccinating. During the first portion of the vaccination campaign, we were largely focusing on healthcare workers, people in public safety, and residents in congregate settings. We are already starting to see results. We know in being very targeted, we're going to minimize waste of any vaccine, and we're going to make sure that the individuals that are at highest risk get access to it and have the greatest impact we need to protect our healthcare system capacity. So even if that takes time, it has really been about the quality of the individuals that we have focused on vaccinating. If you can display the slide with our healthcare workers' cases on the screen, you can all see a precipitous decline in cases among healthcare workers since we started vaccinating, focusing on them. While our case rate decreased statewide during this period, our case rate among healthcare workers has plummeted in a very good way. We've also seen great results in our long-term care facilities. This is encouraging news. We have a vaccine that we know works. We don't have a lot of it, but for that reason, we are being very targeted, more targeted than many other states, in who we are vaccinating, particularly during this first portion of the vaccination campaign. And as I've said, who you vaccinate matters. The message for you is that it's working. Our early approach to vaccinating is allowing us to preserve our healthcare system, and is protecting residents in our nursing homes and assisted living facility, those precious individuals who have been at highest risk of hospitalization or fatality. As we look to the next portion of our vaccination campaign, we will be focused more on the general public. There are three main locations where people are going to be vaccinated. I talked about this where last week. The first is a retail pharmacy. The second is a local or regional vaccination site. And the third is a state-run vaccination site. This week, CVS and Walgreens, for our retail pharmacy approach, will be getting 7,000 doses for people 75 years of age and older. They're each getting 2,000 doses from our federal allocation, and CVS is getting an additional 3,000 doses directly from the federal government. This is a continuation of the vaccinating of older adults that the pharmacies have been doing for several weeks now in other settings. For the local or regional clinics, those will be restarting next week. The cities and towns will be getting 7,800 doses each week for the next 4 weeks for people 75 and older. That is 7,800 doses total, not 7,800 doses for each city and town. Vaccination clinics are going to be running in cities and towns, at schools, at senior centers, and other sites for first doses over the next month, starting next Wednesday. Our cities and towns have been excellent partners for supporting our seniors and helping to ensure that regardless of their access, their understanding of the registration process, or ability to get to the site to get vaccinated, they have worked hard to make sure that our seniors 75 and older have access to the vaccination that's needed. The clinics that will be continuing with our cities and towns are registration only. You cannot walk up and get vaccinated. You need an appointment at a particular time, and you only need to show up exactly when that time is there. There isn't any need to show up earlier in order to miss running out of vaccines. We've worked hard to ensure that if you have an appointment, there's a vaccine ready for you at the time the appointment has been set up. Appointments are being handled by cities and towns. For people who make appointments with these local clinics, remember, show up at the assigned times. Appointments have been spaced out so that we can avoid crowding. We do not want people in crowds and do not want people standing in lines in the cold. If you have registered, there is a dose for you. You do not need to worry about the clinic running out of vaccine. And finally, our third where is our state-run vaccination site. These are the last types of sites where vaccinating will be happening. Next Thursday, we will open a state-run vaccination site at the Dunkin' Donuts Center in Providence for people 75 years of age and older, and our Sockanosset Crossroad vaccination site in Cranston will open for people who are 75 years of age and older as well. For the last several weeks, healthcare providers have been getting vaccinated at Sockanosset Crossroad, and we're going to start doing some healthcare providers at the Dunk over the next few days, which will help us plan for the big launch on Thursday. Our goal with our state-run vaccination site is volume. We will have the capacity to vaccinate hundreds of individuals per hour through those sites. We will be doing roughly 500 doses per day at the Dunkin' Donuts Center to start with the public, and roughly 900 doses per day at Sockanosset to start. As more vaccine becomes available, we will expand capacity, and we will open eligibility to additional groups beyond people 75 years of age and older. This is very exciting news. While a lot of our other vaccination venues are more targeted, these state-run sites are the places where we will be doing our greatest volume of vaccinating. Like the city and town clinics, you need to register for these state-run sites. You cannot walk in without an appointment and get vaccinated. Next Wednesday, we will announce the registration link for people who are 75 years of age and older for these 2 additional state-run sites. We will also announce a phone number that people can call to make an appointment if that is their preferred method. People will be able to start registering on Wednesday for appointments starting Thursday, and on Wednesday, 2 weeks of appointments will open up at that time. I want to reiterate that not everyone 75 years of age and older who goes online or calls to make an appointment will get an appointment right away. There is still more demand than supply right at this time. We understand that people are frustrated by that. We are frustrated too. We wish more vaccine was coming into Rhode Island. We're doing everything we can to help make that happen with our federal partners, and we will get to the point where everyone who wants to get vaccinated can get vaccinated. Until then, we're asking you for your patience for a little while longer as we continue to focus on the most vulnerable to keep them out of the hospital and to keep them alive. Before wrapping up and handing it off to our Lieutenant Governor, I'll make one point on testing and one point on treatment, as I always do. It's all about testing, treatment, and vaccinations to get us through the remainder of this. While the testing site at the Dunk closed last week, we have opened a new testing site in downtown Providence at 79 Dorrance Street. This site has Binax tests, rapid tests with the same setup of results within 15 minutes. This is a walk-up site as well to increase accessibility. For most of our other 35 sites, you can make an appointment at portal.ri.gov to get tested. There are free same-day test appointments available. With the more contagious variants already present in the U.S., testing is more important than ever. It's a great thing that Rhode Island is leading the nation in testing. As I said last week, everyone should consider getting tested every week, especially if you're out in the community a lot. And lastly, treatment. Get educated about treatment at covid.ri.gov/treatment. You should especially do that if you are 65 years of age and older, or if you have an underlying health condition. Because if you were to test positive for COVID-19 and have symptoms, those who are 65 years of age and older or have an underlying health condition qualify to get treatment that works to keep people out of the hospital. Vaccine is great. We want everyone to get vaccinated. But until we have enough vaccine for everyone, we need people to be taking advantage of the testing and the treatments that are available. Treatment is extremely effective, and it's available even if you don't have a doctor. Again, for more information, go to covid.ri.gov/treatment.